I was using the same strategies that I was learning, which is counting calories, making sure that they eat less calories than they spend. Also exercise, like running, doing some weights, all of that stuff to help them to kind of look better. Some people would lose some weight and some people did not. That really bothered me because I said, wait a second, I'm doing the standard of care. Like I'm doing what's written in the books, but it wasn't working on some of the people I was working with.
So us as functional medicine practitioners, we have to take a personalized look for our patients as to the reasons why their metabolism isn't functioning the way it should. And there's a few different reasons that this could be happening.
We really want to answer the question, can functional medicine help with weight loss? And this is an especially important podcast because we know that statistically 6 out of 10 adults are overweight and about 4 out of 10 adults are obese in the United States. Unfortunately, obesity or overweight, it significantly increases the risk of cardiovascular disease, of stroke, metabolic syndrome. And so as healthcare practitioners, it is really, really important for us to understand and provide the right strategies for our patients. And one of the biggest challenges that we have is that patients are told to lose weight and they just don't know how to do it. So my name is Tal. I'm the educational director at the American Academy of Functional Health. And with me, we have Dr. Chill.
Hi, everyone.
I'll start by just a little bit of sharing where it all kind of started from me. And it was about 23 years ago, around 22, 23 years ago. I was still developing my skills. I was going through training in the healthcare field. And I was learning a lot about nutrition. I was learning a lot about Chinese medicine, about acupuncture. And my goal was really to help patients that are struggling with pain. And one of my passion is also to exercise, right? So improving your health involves healthy nutrition. That's one aspect. And then the other aspect is physical activity, right? So my schedule was kind of busy. I was studying during the day, and then after at around 4 o'clock, run to the gym when I was training people as a personal trainer. And I was working with individuals who mostly wanted to lose weight or, increase their muscle mass, look better, feel better. I was using the same strategies that I was learning, which is counting calories, making sure that they eat less calories than they spend. Also exercise, like running, doing some weights, all of that stuff to help them to kind of look better. And what I noticed was really interesting. I noticed two things. Some people would lose some weight and some people did not. That really bothered me because I said, wait a second, I'm doing the standard of care. Like I'm doing what's written in the books, but it wasn't working on some of the people I was working with. The second thing was with the clients that I, at the time, were working and seeing them lose the weight as a result of working out really hard, counting calories, missing up on all their favorite foods. What I noticed was that once they stopped exercising, or they would go back to their routine eating or go back to semi-routine eating, they would gain that weight back. And sometimes they get that weight back with interest. So it really bothered me years later when I was actually getting into functional medicine to really comprehensively studying functional medicine to identify the root cause. I started seeing our patients losing weight, not patients that come in for weight loss, but patients come in for arthritis, for diabetes, for autoimmune conditions, for different conditions, and they're losing weight without counting calories and without exercising. So this really made me start thinking about maybe we're doing this whole thing wrong. Maybe we're not addressing weight gain properly, because we're not looking at the root cause, right? And we know statistically that as we age, most adults gain about 1 to 2 pounds every year, right? So it really accumulates over time. And when you think about it, there's a lot of people out there who are struggling with weight. They try different supplements, different diets, different things. So today, I guess the first question that we want to kind of cover, maybe Dr. Chill, you can help me with this, is kind of look at into how does functional medicine look at weight loss, right? How is that different than somebody going to a dietitian and then they give him a food plan and how much calories you eat and all? How is that different?
In my medical career, the majority of my patients are I have a lot of patients. I've had many patients come into me with issues with losing weight. And they have gone to everybody. They've gone to a dietitian. These are people who work out all the time. They're doing HIIT classes, CrossFit, they're eating really well, but they cannot lose weight. The issue is they weren't addressing the root cause, as what you were saying. So this is another reason why I love functional medicine so much, is because we are looking at the root cause or the causes. And with metabolism and weight gain, there are multiple root causes or multiple contributing factors that can be associated with an inability to lose weight. So us as functional medicine practitioners, we have to take a personalized look for our patients as to the reasons why their metabolism isn't functioning the way it should. And there's a few different reasons that this could be happening. There could be issues with their hormones. You might have heard of this. One of the biggest things is there's multiple hormones that we have to look at with patients, right? It deals with sex hormones, other imbalances such as cortisol and thyroid. Those are like the main big players with weight gain. So that's something that I will look at for my patients and to see if any of those imbalances are contributing to their inability to lose weight. For instance, many of my women patients who are having a hard time with losing weight, these women, as I was saying, are generally pretty healthy. They're eating really well. They're doing HIIT classes. Typically, when I run labs on them, what I'm seeing is higher levels of circulating estrogens, which means they may be estrogen dominant. And one of the main symptoms of estrogen dominance is weight gain. And so when we take a look at that and see that as a primary contributing factor, we can do things from a functional medicine perspective to help address that estrogen dominance. Another imbalance of hormones can be with cortisol and HPA axis. We know that stress can be a contributing factor to weight and an inability to lose weight. But what happens if there's excess cortisol, right? What happens if there is a dysfunction in the HPA axis, which is the hypothalamus, pituitary, and adrenal axis? This can lead to excess cortisol, which stimulates gluconeogenesis in the liver. This is going to decrease glycogen synthesis, and this is all going to elevate glucose in the blood. And what happens when glucose in the blood is elevated? That not only causes inflammation, but then that glucose has to go somewhere and it's stored in the fat. So we take a look at the cortisol and the HPA axis as well. And then thyroid hormone. This is another major hormone that can be associated with weight gain because thyroid hormone is meant to increase your basal metabolic rate. If this is imbalanced, this can throw off your metabolism. And one of the most common symptoms with patients who have imbalances of thyroid hormones, in particular with hypothyroidism, is weight gain. And there is research that is showing, and actually I've seen this from a clinical perspective, that even doing treatments from a pharmaceutical perspective of just levothyroxine doesn't necessarily help with excess body weight. So we have to take a look at helping to balance out that thyroid hormone as well. It's also been seen that even subclinical hypothyroidism with higher TSH levels, even within a normal range, they can be shown to have higher weight or higher fat mass. Those are the main things that we really look at as functional health practitioners.
So I'm so glad, Dr. Chill, that you brought up the issue of the hormone imbalance, because estrogen dominance is one of them. There's also the decline in testosterone that unfortunately happens to all of us as we age. But there's something that goes beyond that, which is in the functional approach, we look into why is that estrogen dominance? There's different ways we can reduce estrogen through herbal medicine, for example, or we can use certain nutritional strategies. But the problem is that if we don't address the underlying cause of what's causing that patient to have lower amounts of testosterone or excess estrogen, they might have a higher risk of certain cancers, right? We know that with estrogen. Two, they might be having something like an environmental exposure or decline in their detox ability that keeps spiking that estrogens up. So if we don't address that, then we're going to have other problems down the road we'll have to deal with. So when it comes to, so you mentioned the thyroid, that's so important. I've seen that over and over again. Patients come in, they're on levothyroxine. They said, my doctor gave me a prescription for thyroid, for hypothyroidism, and they still struggle. They still have sensitivity to cold. They still feel fatigued. They still have constipation sometimes, and they still struggle with weight gain. I'm so glad that you mentioned that particular aspect of levothyroxine, which is the hormone replacement therapy. In many cases, does not address the excess weight. Maybe in some cases it helps, but in many cases it doesn't. And that's typically happens because we did not look at the root cause of the thyroid imbalance. One of the things that we're going to think about is that hypothyroidism, majority of the hypothyroidism patients, 60 to 80% kind of estimated, are because of an autoimmune condition, because of a chronic inflammatory condition. Meaning the patient has inflammation, chronic, systemic, that keeps attacking their thyroid. And the problem with that is that over time, it messes up the thyroid hormones. Now, the patient goes to their doctor. The doctor looks at their TSH, T3 or T4. In most cases, they just look at TSH. And they say, oh, you got lower amount of thyroid hormones. Let me refill those hormones by giving you a medication, right? So you're basically taking a synthetic form of that medication. The problem is there's not enough production of that, right? It's kind of like having a bucket of water and you got a hole somewhere or 2 or 3 holes and the water is all dripping down, right? You can keep refilling it. Wouldn't it be smarter to find out where the hole is and cap that hole? So this is when looking at the root cause of the problem is really what we want to focus on. And this is something that is really important for all healthcare practitioners to understand. If you're interested in learning about these factors from a functional and an integrative medicine approach, I invite you to join our Functional Weight Loss Summit, where we're going to, together with several experts, dive deeper into the 5 major physiological factors that lead to weight gain in the functional medicine approach. We're also going to look into the specific functional or specialty lab testing to identify those root causes. And we're also going to look into how to create a personalized treatment plan for your patients. We're also going to cover the clinical application of nutritional, herbal, and probiotic supplements for weight loss from an evidence-based approach with specific treatment protocols. This event is live, so you can ask questions and you get all the recordings and handouts and clinical guides with it. You will also learn how to guide your patients towards better health and function so they can feel and look better. Click on the link below and secure your ticket now. I'll see you there.